On Thursday, the European Commission announced member states could use an EU social fund to provide abortion care for women facing barriers. The Commission stopped short of creating a new funding mechanism, which was requested by the European Parliament in December. The decision therefore drew mixed responses. Women's rights groups and activists hailed the decision, while critics argued that without establishing a dedicated fund, the EU was effectively rejecting the Parliament's proposal. Euronews spoke with the coordinator of the citizen-led initiative that brought it all into action.
What does yesterday's decision mean for women across Europe, particularly for countries where there's more heavy restrictions or complete restrictions in place, like Malta? What does this mean for them?
I think that yesterday's decision was a historic one, and it was a historic for women and also for the European democracy. It was for the first time in history stated that abortions can be funded by the funds of the European Union. And this was said very clearly, and it was also clear from the speeches of the commissioners that European Union will make a commitment to reproductive health.
My Voice, My Choice is a European citizens' initiative, a mechanism that allows citizens to call on the EU to propose new legislation. If an initiative gets at least 1 million signatures across 7 EU countries, it gets considered by the bloc's institutions.
We brought something to the table. We brought our own chair to the places where we usually don't have the chairs. And I think it proved through these 3 years that together we were able to make a change.
My Voice, My Choice did express its disappointment that a dedicated fund wasn't created, but welcomed the development as positive progress nonetheless. The move marks an unusual step taken by the European Union, as healthcare policy is typically determined at a national level.